It is estimated that 537 million people are currently affected by diabetes globally, and 6.5 million patients suffer from chronic wounds in the U.S. alone, primarily as a consequence of underlying conditions like diabetes and cardiovascular disease. These wound patients are vulnerable to infection, amputation, and even death. According to the International Diabetes Federation, a patient limb is amputated every 30 seconds. In response to this urgent, critical global need, Legacy Medical Consultants developed the Zenith Amniotic Allograft for advanced wound care. When a wound fails to close by 50% after 4 weeks of conventional care, clinicians should consider an advanced wound care modality such as an amniotic graft. Amniotic grafts like Zenith provide a reliable protective wound covering that adheres to wounds without sutures. The Zenith amniotic membrane provides an extracellular matrix that acts as a scaffold for native tissue. Zenith is stored at ambient room temperature, which allows for ready application to the prepared wound bed. Zenith amniotic allografts are produced in a state-of-the-art U.S. facility, where safety and sterility practices exceed the strict requirements of both the American Association of Tissue Banks and the Food and Drug Administration. The Zenith amniotic membrane was awarded the FDA's Tissue Reference Group confirmation status in 2021. Lastly, Zenith is approved for use for a wide array of wound types, including acute and chronic wounds, diabetic foot ulcers, venous leg ulcers, deep tunneling wounds, surgical wounds, pressure wounds, burns, and trauma wounds. Legacy's global mission is to reduce the cost burden of wound care and improve patient outcomes. Several studies have documented the annual treatment costs of diabetic foot ulcers to exceed tens of billions of dollars globally, with the overall cost per patient doubling when amputation is required. However, a 2020 analysis of wound healing studies demonstrated the advantages of amniotic allografts. As compared to standard of care treatment by itself, amniotic allografts increased the total wound healing for diabetic foot ulcers by nearly 400% in the first 6 weeks. This has huge global implications for improved patient outcomes and cost savings. We are biologic experts whose singular focus is to rapidly and effectively address the unmet need for advanced wound care around the globe.